Assalamu alaikum. Today I'm going to continue with yesterday's topic on going to a doctor. How to talk when you visit a doctor, right? So I've asked you all to do an assignment, and probably there is some confusion as to what kind of assignment is required of you. First of all, please remember I'm not going to ask you any silly assignments. I'm just asking you to bring in some variation in how you pose a certain, how you posit your ailment in front of a doctor. So when you visit a doctor, God forbid, you should not, I mean, not unless it's a very good reason. When you visit a doctor, you're supposed to speak plainly, very simply, plainly, and not leave out any details. That should be of prime concern to you. And since this is a conversational class, you need to understand that there is just not one route, one way of speaking or telling something about yourself to someone. Okay, so there are plenty of ways. So one instance could be, you could simply say, I have a fever, I have a headache, I have a stomach ache. Or you could bring in some variety. I know it's not really a very good way, a topic on which you need to ponder upon variety and all that. The main purpose should be, the main intent should be to convey the message. This should be that's what should be your prime concern. But so one way of saying is that I have a certain thing, I have a certain problem. Or another way of saying is that you have had certain problem. Or you could say that mm, this headache doesn't seem to go, or something like, I've had this problem for some time now, if it's a problem that has been there for some time. Or you could say, mm, my migraine keeps recurring again and again. Is there something you can do? Suggest some permanent remedy or something I can do whenever I have this problem. You know, you can bring in some variety in projecting your ailment. That's what my assignment was about. Okay, so just one line, or probably one or two sentences maximum for each ailment. Tell ailments and all. Okay, 10 illnesses and all. Okay, so that's your assignment, and I'm going to extend the your deadline for your assignment, for submitting your assignment. So don't worry about it, take your time. You can take another 2 days for it. Okay, so coming back to talking about the way you need to communicate with your doctors, I've already said, first of all, be polite. See to it that you address them by their proper designation, proper title. Okay, and if not, just stick to sir or ma'am. That should be enough, because sir or ma'am itself conveys a certain amount of respectability, and you wouldn't come off as being offensive. So always say not merely thank you, but thank you sir, or thank you ma'am. Or if it's a youngish kind of person, someone younger than you, well, you could go ahead with thank you Mr. So and so, thank you Dr. So and so, and thank you doctor would be enough. Or thank you sister, as in a nurse. Okay, thank you nurse, or thank you sister should be enough. All right, and also remember to add please in the beginning of your sentences whenever you're making a request. Could you please, can you please direct me to the room number so and so, or can you please direct me to so and so doctor, or could you please check for an appointment. If you don't mind, can you please tell me when my appointment is? It's scheduled for 1:30 and it's already 1:45. You could always make your tone a little softer, right? It does not mean you have to speak softly. Just tone down your speak very mildly, in a very mild tone. That wouldn't come off as ordering. It should be more of a request. Okay, because as I said earlier in my last class as well, everyone in a professional setting is bound to be busy, is bound to be crammed up with work. Okay, no one is idling around, so they don't have to dance to your tune. Okay, don't expect that they have to serve you first. Okay, so they may have plenty of other work, so be patient when you talk to them. Okay, so first of all, when you go to a doctor, before you go to a doctor, you need to remember that you have to do a certain things. Okay, have a certain mindset, set an agenda. Okay, because see, this is something I picked up from John Hopkins University's John Hopkins Medicine.org, an official website from John Hopkins University. I'm relying mainly on blogs and such, websites, mainly because the guide you have is good enough, no problem about it. But even that is very general in nature, and this too will help you, because see, the main purpose of this syllabus is that you understand how to communicate, you learn how to communicate, and it's supposed to be a very practical subject, wherein in a class setting we discuss and we talk and we we converse, we practice conversing in these settings. Okay, or we can have some we can take up role playing. That's what is supposed to be done in a natural class setting. But in this virtual world, it seems not entirely impossible, but it's kind of impractical to suggest that I would assign certain roles to each one of you and make you talk and discuss, like one role to be taken up by probably Kausalya. I believe there is one Kausalya in your class, I suppose, and one role by Aisha, and one could be a doctor, one could be a patient, another could be a sister, one could be a receptionist. I mean, in an ordinary class setting, this is what we will do. Okay, but in this online platform, it seems very difficult unless we have a Zoom meeting. And I hopefully we will have one soon, inshallah. Okay, I'm planning on it whenever the day is convenient for all of us, we'll get together and do it. Okay, or on an online platform. Okay, so starting off with this idea, we've got some 5 basic points. This website suggests you remember before you visit a doctor. First of all, you need to set an agenda. Set an agenda as in you need to pre-plan. You need to plan what you're going to do when you visit a doctor, because see, generally, in a normal clinic, as in like a local clinic or dispensary, the doctor's visits are very short. Okay, the doctor is like cramped up with too many patients and has and doesn't go by appointment. It's just tokens that you have, and the doctor can hardly give you more than 5 to 7 minutes at a time, within which you relate your problem in a very specific terms, and he suggests some um, symptomatic treatment, right? He mainly deals with a symptom. But if you are going to a specialist, you are offered around 15 to 20 minutes of visit time, doctor's visit time. So in these 15 to 20 minutes, you can relate your problems, and you can also, the doctor will also expect you to give, if it's a first visit, the doctor will also expect you to give some history, some history of your illnesses, or your hereditary illnesses, in like your parents' history and all of those things. The doctor will expect you to relate all of those, right? So you or if it's like recurring visit, as in like you are going for a review to a doctor, you've already consulted with a doctor and you're going for a review, again the doctor may not be able to spend as much time. Okay, so the first visit is always lengthier comparatively speaking. Okay, the next visits, the recurring visits, uh, will be will be much shorter. Okay, be prepared for that as well. So many doctors visits last only 15 to 20 minutes, so it's important to prioritize your concerns. Prioritize your concerns is in, you need to make sure which is most important. Sometimes what happens, we have multiple problems, and when we go and relate to it, we tend to leave off the main problem. I mean, not even a main, but sometimes the second most important problem, we leave it out. Okay, so you need to make a list of things that actually bother you too much, that is compelling this visit. Okay, that has brought about this visit to the doctor. Okay, now, so you need to prioritize the concern by setting an agenda. So, according to this person's research, the length of an appointment matters less than its quality. Before the visit begins, create a list of topics that you want to address, introduce them at the start of your visit. So, you need to start off by saying what exactly ails you. Okay, and yeah, the way in which time is used really makes a critical difference. Your outline doesn't need to be complex, it can simply be that you have medical problems, fears, or worries that you want to discuss. So, No problem is a small problem when it comes to visiting a doctor. Please bear that in mind. But also try not to be a nuisance, because like there are plenty of people who are, hypochondriacs, who tend to imagine problems, have an imaginary, it is not exactly an imagined problem, but it's a probably a neurotic condition that actually makes them believe that they have a certain problem, and that needs to be addressed, by a specialist as in by a psychiatrist, by someone who can give them good counseling. So even that cannot be disregarded, because the very often it so happens that there are people who tend to think they have certain problems, whereas some non-existent problems, but they, instead of ridiculing them, you need to take them to for proper counseling, for good counseling, because by ridiculing them you are ultimately going to bring in, invite more trouble for yourself and for that person as well. Okay, so these troubles, it's okay, fine. I wouldn't go into it, but just see to it that you prioritize all your problems before you go to the doctor, because that way you'll be able to communicate well. The point is that when you have matter in your head, it's easy to tell. Okay, when your mind is empty, like obviously you do have the stuff to tell, but you do have things to tell, but if it's not organized, your mind keeps scampering, looking for in what order to tell. Okay, be honest. See, it is one of the most important things that is required of you when you visit a doctor. Other than the hypochondriacs, other than the people who tend to imagine they have problems, it is necessary that you be honest in what exactly you have. Some people are shy, some people tend to over exaggerate. So both these things could lead to misrepresentation of your symptoms, misrepresentation of your illness, or a poor understanding of your illness, right? So it is necessary that you be honest with your doctor. It is important to share things about your lifestyle, social obligations, and relationships at home and at work. Sometimes patients are fearful that the doctor isn't interested or that it isn't relevant. So when you find that the doctor is not interested in what you have to say, if it's a serious concern and the doctor is just just shooing it away, saying, oh, it's nothing, it's all right, please don't go to that kind of doctor, because a doctor is supposed to listen to you. Okay, whether you're right or wrong, whether it is real or imagined, the doctor is supposed to listen to you. Okay, so or it isn't relevant, the doctor will decide whether it is relevant or not. Okay, you don't have to force that person to believe that a certain problem, if you have a knee problem, and then you also have something on your neck as in, like, probably you have some spondylitis. Okay, and you just because it doesn't seem relevant. Okay, say for instance I have spondylitis, and I do not tell the doctor that I have knee problem as well, that I have some difficulty climbing or getting down the stairs, right? So it is not for me to decide whether it is relevant or not. My duty is to tell everything that is there to be told about my health. Okay, overall health, whatever is bothering me, I should tell. Whether or not it is relevant to the main problem is something the doctor will decide. Okay, not I or nor you. Okay, so make sure that you tell everything that is there to be told about your health. Okay, so and also, of course, your food habits, your lifestyle, all of these, if the doctor is if you're accorded enough time, you should be able to tell them all if the doctor asks. Okay, so but providing detailed information helps a doctor get the full picture of your overall well-being and assess lifestyle factors that might contribute to your health. Also, don't be afraid to bring up pain or a feeling that's bothering you, even if it's embarrassing. Your doctor's job is to help you feel better, and he or she is required to protect your privacy. So, even if it is something that is embarrassing, it is necessary that you talk to your doctor. Okay, and it's doctor's job that he or she maintains your privacy, that he is not at liberty to discuss you with anyone else. Okay, they are bound by their oath. Ask questions. Medical visits can be overwhelming, and sometimes even the most well meaning doctor can present too much information too quickly and in complex terms. See, the medical jargon is so complex that most of the time people, the patient tends to come off being a bit overwhelmed, right? So sometimes a simple ailment could be related by the doctor as something very serious, and the patient would ultimately expire of fear. It doesn't really that go to that level, but then it does happen that we are quite confused by the complexity of the words used by the doctors. So it is necessary that you ask questions, because it's not a matter of any something that you can easily disregard. Okay, so it is necessary that you ask questions when you're confused. You need to and if the doctor seems to be going too fast, you can ask the doctor to slow down a little and explain it in simple terms, like just as you asked me to do. Right, you asked me to, ma'am, please slow down, you're talking too fast and your speech is not easily understood by all of us, and some people can, some people don't. So you can apply the same concept to visiting a doctor. So, but try not to be too slow. But you can also ask a question, or pose a question very politely. Sir, I'm sorry, but I did not understand so and so. What does it mean? Right? And there are doctors who are really good doctors who explain everything. I mean, that's the quality of a good doctor, right? They have to explain what your problem is to you. So it's okay to ask questions, and you should feel comfortable asking as many of them as you need to understand your doctor's advice. Sometimes people are reluctant to ask questions. Ask your doctor to clarify what they are saying in plain language if they are talking in medical speak. It's perfectly fine to say, sorry, I'm just not following you, can you explain that in another way? And the doctors, one advice, if there is a doctor, anyone listening here, for the doctor is to please make it simple. Okay, whatever you're saying, make it simple and stupid. Because see, stupid is a very derogatory term used for people who lack any deep understanding. But the point here I'm trying to make is that stupid is actually something that is very, very simple, easily understood. See, no idea is too complex to be broken down into pieces. We are not talking in terms of metaphysical terms, that would be abstract. We are talking about our bodily functions, we are talking about our anatomy, our psychology, probably our physiology, right? So it should be easy enough to tell in very simple plain terms what the problem is and how to deal with that problem instead of using medical jargon. So one advice to the doctors is that please try to use very simple terms when you talk to your patients. Okay. Next, repeat the information back to your doctor. This will help you absorb it, and it will also help the doctor know whether you understood. And if you didn't understand everything, that's perfectly natural too. Often a doctor will need to repeat information in different ways so that it's clearer. Be sure your doctor has understood what you told him or her. For example, if you talk about a concern such as a lump in your breast and your doctor brushes it off, don't be afraid to revisit the issue. Or see, it's a very important concern. Having a lump anywhere in your body is not something that can be easily disregarded or ignored. It's not something a doctor should ignore. Okay, so it's necessary you visit the doctor once again, or go to a doctor who can actually listen and take it seriously. Okay, and also, of course, there are doctors in the medical profession who try to fleece you by making things up that are not there. So try to avoid from those people as well. Keep away from those people as well, but still make sure that you visit a doctor who can actually listen to your concerns, and if there is something something that could turn into a serious issue, he listens to you, he or she listens to you. And if that person is not willing to listen to you, you better change your doctor. We know from studies that physicians tend to reassure patients a lot, and patients sometimes feel that this reassurance is premature. It's fine to say, I'm not sure you really heard how concerned I'm about this. So again, this is something that happens quite often. There are times when you are taking something very lightly and the doctor tells you to be a little serious about your issue, and there are also times when you are taking something very lightly, and yeah, vice versa. So it happens. If you emphasize your concerns, your doctor can explain his or her reason for reassuring you and revisit the issue more deeply. Work collaboratively. Work collaboratively in the sense you need to work together. Patient and doctor both need to work together. Finally, it's important to work together with your doctor for the best outcome. If your doctor recommends a treatment, share your worries about possible side effects or questions about other options. This is a way to actively partner with your doctor to make treatment decisions that are most likely to work for you. It's a win for you and a win for your doctor, so don't be afraid to ask him or her to help you understand your options. A critical part of the conversation is saying to the doctor, I understand that all treatments have risks and benefits. Can you help me compare these to other treatments? So, when there are problems, when there are issues, that need a certain specific kind of treatment, and that treatment by probably by experience or by having heard of someone else close to you, having gone through the symptoms, having gone through the treatment, not really faring that well, it is necessary that you open up and talk about the treatment to the doctor. Do not blindly agree to just about anything your doctor suggests. Okay? Be informed. Being well informed is necessary. At the same time, it is also necessary that you listen to your doctor to some extent. Okay? And also not blindly accept everything the doctor tells you. So, see, it is a very fine balance you need to strike between uh, belief and disbelief. Having faith and suspicion, you know so most of all, try to control your anxiety by expecting good outcome before the appointment starts. So just relax from the beginning. That will help you communicate better, converse better with the doctor. Okay, so when you visit the doctor, first of all, you would have a reception, that is if it's a big hospital, where you need to pose your question explicitly, very clearly. Okay, clearly ask for a doctor who could address so and so problem. If you're already familiar with the name of the doctor, you tell them, could you please direct me to doctor so and so. Okay, and once the reception asks what your problem is, you could tell them in very plain, you don't have to go too deep. Okay, you could simply say, okay, abdominal pain, or probably headache, or probably something, and if they are asking very specific questions, you could say that please direct me to a doctor that would deal with a particular organ. Okay, if that is what you think your problem is. Okay, and yes, they may give you a form to fill or something. You fill it up very clearly, with very honest answers if possible. And once you hand it over, the receptionist or whoever is in charge of the reception, they will direct you to a certain floor or a certain place. There you may have to present your file. There may be another reception there. You may have to present your file to the sisters or whoever is in charge there, and then they will further ask you to wait for a bit more. So this is when we start panicking a little bit. So it's better to relax a little and think of what you're going to say. If there is someone accompanying you, you better discuss with that person, whether it's your parents or with your spouse or with your children, whoever it is, discuss with them what the problems are. So they may be able to contribute to your understanding of your own disease. Because what happens is, like, one thing seems to get stuck in our mind, that we easily ignore or forget other parts that have been troubling us. So they may help you to list out, or rethink everything that has been bothering you for some time now. And once you have made a list of it, a mental list of it, or maybe even you can even put it in writing if necessary. Okay, once you have made a list of it, you can when you are called into the doctor, you can go, and when asked, you can start off by listing out all the problems that you have. Once you have listed out the problems, the doctor will do a casual checkup. Okay, a physical checkup. And sometimes it happens even before you get into the doctor's office. You may be checked by the nurse herself. Okay, so even that is quite possible. So before you enter the doctor's office, he may have he may be he may have already taken a look into your file made by the nurses at the nurse station. And and he may be aware of your temperature, of your blood pressure, your height, weight, some previous history that you have already filled in the form, right? He may have that in front of him, and he may already be a little mildly familiar with your problems. Yeah, okay. So in your own way, in your own, from your own words, he may be able to decipher what exactly your problem is. He may have a guess, he may assume certain things, he may be sure of certain things, we never know, he or she. All right. So once that is done, and you see, he may ask certain questions. So this is where you need to be very, very honest about how you answer those questions. So try not to exaggerate, or try not to be overcome by shyness or embarrassment. So whatever questions are asked of you, be very specific in answering them. Say, if they ask you, if the doctor asks you, do you how many hours do you sleep? So if you are someone who stays up quite a lot at night, please be honest about it. Okay, you could say, no, I don't get to sleep much. I go to bed very late at night, and have to get up very early, so I get very little sleep. So the doctor may have some understanding of your lifestyle, your habits. Again, if he's asking for, do you eat your meals properly on time? If so, if yes, you can say, yes, I have all my meals on proper time. I have my breakfast at this time, lunch at this time, dinner at this time. Or if you're skipping meals, you need to mention that as well. If the doctor asks you if you've been if you're active throughout the day, well, if you're active, feel free to say, yes, I am active. I have a certain job that keeps me on my foot all day. Or you stay at home, that I walk a little bit and sit a little bit and lie down a little bit, and that's how your life goes. Or if you are someone who is addicted to bed and your mobile, that you just keep lying on your sofa all the time and watching movies or listening to songs, please feel free to tell that as well. He may ridicule you, he may mock you a bit, he or she may mock you a bit, but they'll get an understanding of what your lifestyle is. See, a lifestyle is contributes mainly to your well-being, your physical and mental well-being. So make sure that you're always honest about your honest about what sorry honest about answering the questions posed by your doctor. All right. Now, if you enter the room expecting that the doctor is going to help you, then it sets the tone. The best doctors are trained in mindfulness, for instance, which tells them to take a minute to focus on the new patient and really see the person in front of them. And I think patients need to do this too. See, one thing I have understood from observing doctors, see, I've made too many hospital visits in past 1 year, and even before that. So, um, I I believe I can safely say that I have an understanding of who a good doctor is. What makes a good doctor? A good doctor listens to the patient. Okay, first of all, a good doctor listens to the patient rather than hear from others what the patient is how the patient is behaving, or what problems the patient has. So it is often better if the patient speaks for him, or for him or herself, rather than someone else speaking for the child, or for the person. Especially if it's an adult, it's necessary that person speaks for him or herself. All right. So, and when the patient speaks, try not to be obtrusive, try not to interrupt when the patient speaks. So a good doctor would be someone who listens to the patient, answers the questions posed by the patient, and doesn't take anything lightly that is communicated by the patient. Okay. So there is this mantra that I have heard from a few of the good doctors, is that the patient is always right. The patient is always right, in the sense, and also patients have this, I mean, the doctors have this discerning eye, you could call it discerning eye, as in, wherein they recognize real ailments from those that are imagined or fake. So you know it's necessary that you be concise, very, very specific in what your problems are. And if you cannot explain, there are certain conditions that cannot be explained right? So when you find that you are unable to explain a certain problem, you could take help from people around you, okay, people around you in expressing those problems. And also, uh, conversation requires both speaking and listening. Please bear this in mind as well. So it's not merely enough, it's not merely necessary that you communicate well and speak well. It is also necessary that you hear well, you listen closely to what the doctor has to say, so that you can avoid further confusions. And if you do not understand something, it is very, very important in that setting to ask questions and clear your confusions before you leave the doctor's office. I believe I've spoken enough for now on this topic. Just do your assignments. That should help you with how to communicate in at the doctor's office. So this is all for now. Please submit your assignments as early as possible. And thank you so much. Thank you so much for your patient listening. Okay. All right. Some problem with my phone here. Okay. Okay. Stay safe. Jazakallahu khair. Assalamu alaikum.